5:30, so we're going to get started. I'm Heather Kleinberg. I'm the Inpatient Services Manager here at Stoughton Hospital. And I'm also a member of our Dementia Friendly Coalition in Stoughton. You can't hear me in the back? No. Oh, you gotta really put this microphone close to your face. Okay. So before we start, I just want to go over some logistics. There's restrooms are down the hallway when you just came in, to the left, and by the elevator bank. There are restrooms there. So, also we have some bottled water if you need any. Help yourself. You saw the table here with resources. If you need any information, feel free to help yourself. And then lastly, if you have any electronic devices, just shut those off, please, or put them in silent now if you would. Thank you. So that said, welcome everybody. This is a big audience, and we're really excited to see all these faces up here. So we have a local celebrity among us, and I think that brought a big crowd, so thank you. But together, the Stoughton Public Library, the Stoughton Area Senior Center, Stoughton Health, and the Stoughton Dementia Friendly Coalition are super excited to welcome Dr. Zorba Paster here with us tonight. Thank you. Dr. Paster has been a practicing family physician for more than 45 years at the Dean Clinic, SSM Health of Oregon. He's also a clinical professor of family medicine at the University of Wisconsin-Madison, actively involved in teaching medical students and residents. However, most of us know him for his decades of work on the public radio show Zorba Paster on Your Health, which is produced by Wisconsin Public Radio and carried by more than 100 stations nationwide. In addition to that, you also know him for his TV commentaries on WISC TV Channel 3, and for his medical columns in the Wisconsin State Journal and other newspapers across the country. And then in all of this free time you have, right? You're a busy fellow. He's also the editor of a monthly newsletter called Top Health, which has more than 1 million readers. So I could go on and on and on and on about all of the great things about Dr. Paster, but I'll turn it over to him and you can see for yourself.
Thanks a lot. Can you hear me?
Yes.
Good, I'll talk softer. So, thanks for inviting me to be here. You know, I live in Oregon. I live just outside of Oregon. Stoughton was always enemy territory to the kids. I mean, come on, the soccer team and everything else. You know, so I told my kids I was speaking in Stoughton, and they said, "Why would you speak there?" I was just in Seattle with them. It's really, it's kind of funny. But a few stories. But before that, I want to just talk to you a little bit about what we're going to be talking about today, and then I'm going to give you a little handout. And it's something, oh, come on in, folks. That's okay, I'll embarrass you. That's sort of part of it. You know, if you don't have humor, you don't need information, right? You've got to have humor in this world.
That's right.
Right, yes, right. You know, we all have relatives who have no humor. You know, this shit never got into their brain when they were born. You know, we've got others, and everyone actually, almost half of you rolled your eyes when I said that because you can think of those relatives. Mine was my Uncle Albert. It was so interesting because I have a cousin who I saw, probably about a month ago in Chicago. And the last time I saw her, she was 8 months old, and now she's 67. I haven't seen her since that time. She lives in Montana right now. And I said, you know, I always thought that there was on one side of my family didn't like my father, and then she rolled her eyes and she said, you don't want to know about that. Anyway, so I want to talk a little bit about dementia, but before I do that, I want to give you a perspective. So first of all, I lost my wife Penny about 1.5 years ago. We were married just shy of 50 years. It's a wonderful marriage. It was great. We had 4 kids that lived in enemy territory in Oregon. And we originally were from Chicago, lived in Nova Scotia for a couple of years. We thought we might actually move there because I love the ocean. It had weather like this all the time, but it was too far from family. So we moved back to Chicago for a bit. And then I decided that I really wanted a country practice, and Oregon was where we settled. But about 10 years before she passed, she began having some memory issues. And that's really what I want to talk about today. There are memory issues that occur that are normal in life. Your ability to do the quadratic equation, even if you could do it in high school, you'd have trouble doing it today. I called up my best friend Dan, who wanted a scholarship to Stanford, and I said, tell me, what's the quadratic equation? And he rattled it off right away. And I thought, well, you rattled it off quicker than I could in high school. But there are certain memory things that occur, and certain things that occur through memory loss, some of which you can do things about, and some of which you can't. So I want to give you some good news about dementia and memory loss. And the good news is that there actually is a reduction in the per capita rate of dementia in this country today compared to 10, 20, 30, and 40 years ago. Let me give you the data first of all. So it's from the Framingham Heart Study. Now the Framingham Heart Study that you may or may not know is this big study out of Framingham, Massachusetts. And the study started in 1980, and it was looking at heart disease and stroke. From that, we get the information on how low your cholesterol should be, what your blood pressure should be, and a whole bunch of other information. But they also did questionnaires initially, and they looked at what the prevalence of dementia was in 1980, 1990, 2000, 2010, and 2020. So they've got Framingham 1 and Framingham 2, and they looked at the prevalence of dementia. In all groups but one, and I'll tell you what that one group is in just a minute, the dementia has decreased. So as of now, there's roughly, per capita, 25 to 30% less dementia today than there was in 1990. Now we're living longer, but there's less dementia in all groups but one, high school dropouts. High school dropouts have the same rate of dementia today as they did in 1980. And so you look back and you say, why is that? Well, then you look at high school dropouts. Generally, they may drink too much, they may smoke cigarettes, they don't take care of themselves, there are financial issues, they don't educate themselves as you're doing right now. So from an evolutionary point of view of adaptation, they don't have the same adaptation that you have. And I think that's really important. It's also treating high blood pressure, high cholesterol, not drinking as much, not smoking. Let's not forget that in the 1965, 64, when the Surgeon General's report came out, 65% of all men smoked and 55% of all women smoked. How many of you smoked in the past? How many of you want to admit that you smoked in the past? It turns out tobacco is a leading factor for dementia and other things. Now, I want to give you an idea of why you should take action and what actions you should take. So I want you to imagine something. You can close your eyes. Closing your eyes would be good. I want you to picture a rectangle, okay? And the rectangle has 52 boxes across. That's for the 52 weeks of the year, okay? And 100 boxes down, and that's if you live to be 100. So it's 52 boxes by 100 boxes, okay? That's your rectangle. When you're born, you're in that upper left-hand corner of that rectangle. Little babies. Where are you now? You're way at the bottom of the rectangle. And it's very, very important to realize that. You may feel like you're going to live forever. You might not live forever. You don't really know. But you know the biggest cause of death is age. And the fact is, you're all older. I mean, this is not a 20-year-old crowd. So that it's very important to think about that as you're beginning to take action for yourself or your loved one, to realize time is limited. When am I going to make a change? Very, very important. I kind of look at it as an hourglass. You start out with an hourglass. You remember those timers for 3-minute eggs? And by the way, 3-minute egg was always running, and you really need to do it about 6 minutes. You remember those timers? You would look at it and a little sand would go down. Our timers are done. You've got to think about that, and that's number one. Number one, you want to think about, when do I take action? And the answer is, you should take action today. And I'm going to give you some ideas of where you can take action for yourself or for your loved one, who may also suffer from dementia. So getting back to my wife for a minute, the first things that occurred that I and my children noticed, and she had some problems. She had fallen down, she had shoulder surgery, had a bunch of other surgeries. But the first thing she had trouble with was staying on task. So when we look at our staying on task, we have to look at what I call 5 dimensions that affect your wellness. And I'm going to touch on them in just a minute. There's a physical dimension, There's the brain, mind, and mood dimension, what happens above your shoulder. There's the family dimension, connectedness. Remember COVID? Does anyone remember COVID? Where we couldn't see our family, we couldn't see our loved ones, we couldn't go to weddings, we couldn't go to funerals, we couldn't hug people. Look at social connectedness. I mean, it ruined a lot. It was very difficult for all of us. That's the third sphere, the third dimension. Heart and soul, what nourishes your heart and your soul. Time with Mother Nature, what do we love? When you came in today, I'm sure you all looked around, and you looked at the beautiful greenery, and you looked at the flowers and everything else. It makes us feel good. It nourishes our soul. And then it's finally where we live. Where we live, our house, our home. Are we happy with it? Do we have some money in the bank to be able to pay our bills? All of these things inevitably affect our health. And they inevitably affect the health of our loved ones, who may also have dementia. Now, there are basically 3 forms of dementia, but most people who have memory loss, they don't necessarily have 1, 2, or 3. They often have 3 of them. I was speaking to the head of the Dementia Research Project at the UW. There's a big project, nationwide project, and the UW is sort of the main focus. It's all over the country, trying to find out what are the causes of dementia. Can we look at that? For instance, like I said, keeping your cholesterol low, not drinking too much alcohol, making sure you don't smoke cigarettes, getting your blood pressure under control. Anything you do good for your physical health is going to reduce the risk of dementia. But what are the 3 forms of dementia? And what can we do about it, and how can we help the loved one? So the first one is Alzheimer's. Now, there is no blood test for Alzheimer's. Not at all. I mean, there is something called the alpha-3 protein that may be associated with Alzheimer's, but you can't go in and do a blood test for Alzheimer's. You can't get an MRI scan for Alzheimer's. You can't get a CAT scan for Alzheimer's. There's no way of determining whether or not you have the plaques and tangles for Alzheimer's. You can look at it from a clinical point of view of whether someone might have it, but it really doesn't necessarily mean anything in what you're going to use. So there's Alzheimer's, first of all. There's Lewy body dementia, as it's called. Lewy body dementia is often associated with Parkinsonism, but not always. So many people with Parkinsonism have Lewy body dementia. I was out in California probably 6 or 8 months ago to see my best friend Larry. Now Larry, who died of Parkinsonism and Lewy body dementia, Larry was the smartest kid in the school. He would correct the math teachers in high school. And you know what they thought of him? It's exactly what you're thinking about right now. He would go up, I can still remember, we had a terrible math teacher, Mr. Hewitt, who would sit in the back of the class and go, Dr. Paster, do solve problem number 15 on page 30. And then he had the answer to it. I had to go up there and he would embarrass people. But Larry went up one day and he solved a calculus problem, which wasn't in the book. And Mr. Hewitt said, that's wrong. And Larry said, no, Mr. Hewitt, let me show you that's right. And then he fixed up everything. Anyway, smartest kid in the class, bright, ultimately developed some Parkinsonism, and then over time began to decline. That was Lewy body dementia. So there's Alzheimer's, there's Lewy body dementia, and then basically there are mixed other forms. Alcoholism is a form of dementia. Multi-infarct stroke, which is very common, that's another form of dementia. They all fit together, and they all fit together into memory loss. So what is normal memory loss? Remember how we used to remember phone numbers? I bet you all remember the phone number that you grew up with, right? I mean, mine was Independence 32993. What was the Stoughton number? Did you need 5 numbers, or did you need 7? Does anyone know? In Stoughton, in Oregon, you only needed 5 numbers. We first, you see, right? You could do it with 7 numbers. So there were times that you had to remember those numbers. And so when you had your best friend's number, you remembered it because you had to remember the numbers. So you may not have that ability, but if you had to use that ability, you could grab it back. You don't have to now because you have this. Now, this is a smartphone. You may be dumb in not knowing how to use it, but it's got all of the information on a smartphone. So we then are going to be able to use other ways of using our brain for other things that are important because we don't have to remember phone numbers. But normally, strings of numbers are the inability to remember strings of numbers, large numbers, decreases with age, and that's normal. In other words, you may have been able to remember 7 numbers or 9 numbers at one time, And now you may only be able to remember 5 numbers. That's a normal sign of aging. Not knowing someone's name is obviously not a normal sign of aging. So let's talk about a few things that you can do with it. So first of all, when we look at aging, I think we also have to look at grieving. Because when our loved one begins to not be that whole person there, it's a grief in action. Because you can't necessarily bring them back. You might be able to bring them with some memories, but you can't bring them with all memories. And you don't know what they're thinking, because even though they say something, it may not be what they're actually thinking. So my first recommendation is, when you're talking to a loved one, if they have a memory loss, if they don't respond what you think is the correct way to respond, do not think that they are thinking what you're thinking, because they may know what you're saying, but they don't know how to do action. So look at little babies. My trainer, I go to a trainer every week because I'm allergic to exercise, even thinking about it, and he just had a baby. It's funny, by the way, I looked at a New Yorker cartoon, I love the cartoons, and it's one woman talking to another woman, and she said, "Why did you decide to have children?" And the other woman said, "We had too much time and too much money, so we decided to have kids." I just got back from Seattle, where two of our kids are there. They're 5 grandchildren. I was telling them that, and they were rolling their eyes. But anyway, do not assume that the person is going to respond in a normal way, because babies don't. You look at a baby and you coo and you look at, and it takes a while for a baby and a child to be able to respond in a normal way. And when it comes to memory loss, it is the same thing. So you should assume that the person that you're talking to hears every single thing you say in their presence or supposedly outside of earshot, because they may be actually mentating, thinking consciously about what's going on, but they can't tell you that. So that's sort of step number 1. Be careful about what you say. Step number 2 is don't expect, at least in this part, a normal reaction. So how do you keep yourself emotionally sort of stable during this situation? Because that's sort of part of the problem when you're going through people with a memory loss. So one of the things, once again, looking at these 5 different dimensions, physical, mind, brain, is social connectedness. So really the next step is talking about it to other people who you know are going to be you're close with. We all have close friends. Most of us. Many of us have 1 or 2 close friends. And then we have other people who are sort of peripheral friends. And then we have other people who say, thank you very much. And they're social, but they're not our friends. But the people who you're closest with are the ones that you can talk to about, and you can, sort of unload some of the issues that you have with taking care of your loved one. Because that's a very important issue. So for instance, there are times, with Kenny, and once again, I'm delving on this because it was a personal journey for myself, when she would be very upset. She would look at me and she would be upset. Now, I could be frustrated by that, but sometimes, because when you live with somebody for 50 years, they know your buttons. And you have a button. I happen to be somebody, I'm very lucky, I don't lose my temper, but I do get upset when things like that happen. So I was talking, my kids told me, I was talking to my kids, very close to me, and they said, you should go to a grief counselor. And Kenny was on a Grace hospice, and I said, oh, I don't know, I'm a male, I'm a doctor, I don't need it. I actually didn't say that, but I thought that. But then I thought, I've got to respect my children, because that's really important. If you don't take their advice, you're not, adult children. I don't mean the 12-year-olds. Or the 16-year-olds. If you take their advice, you'll get into trouble. But I mean the adult children. If you don't take their advice, you have to respect them. So I was shocked. He actually gave me good advice that I didn't know about. So I'm still having this. First of all, I don't lose my temper, but he taught me that I get angry, and that anger is a normal emotion. How you react and what you do with the anger is a totally different thing. But anger is a normal emotion, and often an emotion with frustration. So I was talking to my son Eli, who lives in Boston, and he was telling me, he said, Dad, if you're upset, what you should just do is leave the room, and then come back in the room. And then I discovered something very interesting. That's what I want to pass on to you. When I would get upset, when I would be just frustrated, and all of a sudden I found my emotion rising, this is what I did. I turned around in a circle, and I broke the spell. It was a spell. Once I turned around in a circle, just slowly, and I came back and I looked at her, my first thought was, oh my God, what am I doing? This is my wife, and she's upset, and I'm taking it personally, and she knows that she's on hospice, and she knows that something's going on, and what am I doing? That's where guilt can come in and overpower you, and you don't want that. You don't want guilt. Guilt is not an emotion that you want, so you have to act on it in a positive way, so you can sort of expunge it, even though with people who you're dealing with, who you've lost, or people who are going downhill, you may still grieve over what you didn't do. That is a common emotion, where you said, oh gee, I should have gone to the dog park that extra time, I should have done this and that. So you have to forgive yourself. You have to look and say, I've done my best, I'm doing my best, I will do my best, because my loved one is there, and I'm going to try it again, because there's no such thing as perfect. So I was talking to my counselor. I went there about 4 or 5 times. He was great. It's a funny thing. There's a funny thing about it. So I have 4 kids, 4 perfect children who never get us in trouble, right? Right. You can all laugh like that. But I didn't say, oh, I never had trouble at all. But my wife was a very powerful person. I had 4 kids, and they were giving me advice. So I went to the grief counselor. And I said, all of them, as she's dying, I want to make sure that everyone is on the same page. And it's very important because they're kind of all alphas, they're alpha personalities. My wife is an alpha personality. And I looked at him and I said, have I been a beta my whole life? And he looked at me and he said, I'm a beta too. It's not a bad position to be in. It was sort of a funny thing. But I was realizing, which is another aspect of when you're dealing with memory, is you have to look at those stakeholders. What a strange word is that? You have to look at the friends and the people in your family who are also attending to your loved one and making sure that you're on a similar page. Because if you don't, at the time in which they perish, everyone will be upset, or one person will be upset, or the family will break apart. We all know of families that broke apart. I mean, we all know. I mean, maybe you don't, but I know a family broke apart because they said, you should have done this, you should have done that. Why didn't you do this? Why didn't you do that? So the next aspect you have to think about in that social relationship are the people who are around you. Now, I want to take a little detour into hospice for a minute. Hospice is wonderful. So picture this, at the University of Illinois, it's 19, I went to UW here in Madison. Actually, my first semester undergraduate, I went to the University of Illinois in Champaign-Urbana. Wasn't happy, talked to a friend of mine in Bobby Fields, I don't know where he is now. He went to the administration building and sent me out an application. Said, you should come to Madison, there's beer and the chicks are great. Come on, I'm 19 years old, beer and the chicks are great. You could drink in Wisconsin. You could drink in Illinois, but it was a different thing. Yeah. Walked to the back of the Union, looking at the campus, and I said, I'm home. I still remember that. And I haven't left since. But it's because we have these wonderful social relationships. But getting back, it's very important that you discuss things in an open way with the other loved ones who are involved directly or indirectly in the care of people who have a memory loss. And the reason is, you want to get things out in the open. What do you think about this? What do you think about that? Even if you don't take their advice fully, it's important to discuss their advice and do that, because that will also help you through the grieving process. And it's the grieving process that you want to attend to while the person is alive, because then they can be part of it and know what you're thinking. And then you have a feeling of what you're doing with them, and that puts you in a better place when ultimately they perish from the disease, because we do ultimately die from dementia. I mean, dementia is the indirect cause. In Penny's case, she died of pneumonia, but inevitably, it really was dementia that came in there. So there's an emotional aspect of it, and there's a role reversal that often can occur, especially with parents and a child, where all of a sudden the parent becomes the child and the child becomes the parent. And how do you do that? Well, it's not easy, but it's very important because it's important for the child and for the parent to be able to go on a journey in another direction as they're actually going through it. So that's that emotional aspect that I think is important. The other things that we want to do is you want to set a boundary without guilt. You want to set a boundary without guilt. So I was thinking, in my case, I'm just not doing enough. In fact, people around me said, you're doing just fine. But that didn't matter. I didn't believe I was doing it. It didn't matter that they said it. I don't believe them anyway, although I normally believe them. But that's because I felt like I do be 100%. You cannot be 100% all the time for anyone with a memory loss. It is not possible. If you take anything home with you today, that is the thing to take home. It is not possible. You can be there a lot, but you have to take time for yourself. You have to take time for yourself to do the things that you want to do. You have to take a break so that you can recharge into yourself and have a decent life for yourself, or you will not have a decent life for them. And you're more likely to become angry and upset, and then you're more likely to go down, the black hole of discomfort with them where they don't know what they're saying and you don't know what you're doing. So you must take time for yourself during the day, every single day, of what you're going to do outside of the person who you may be taking care of with memory loss. You have to do it. So how do you do it? Well, you may have friends that may come over, or you may get up earlier, or you may get the person set up into a situation where you can leave them for a while and you go into another room. You don't necessarily have to physically move the space, but you have to pick out a time. And I'm going to give you a checklist of things to do where you actually are able to do it. But along with that, you also have to schedule joy into your life. What gives you pleasure? And sometimes we have to take a little inventory of it. I mean, there's some things we think about when we're with our loved one, especially if you've done things with them all the time, if you've been close with them all the time. What gives you pleasure that you can do? Maybe taking a walk, and maybe going looking at art, maybe playing golf, and maybe something. But you want to take a time during your week where you have time to give yourself pleasure and joy. That gives you time to recharge, but also you're going through this as a person and as a human. And your loved one, especially a loved one that you've had a good relationship with, and if they were able to do things for you, they would say, you've got to take some time for yourself. And that's what you do. It's funny, Penny and I talked about this years before she became demented. And she said, Zorba, if you die before I do, I'm never going to be with anyone else. But if I die before you do, could you wait a month? I'm not with anyone right now. But I said, could you wait a month? It was kind of a funny thing. But it was because she basically, we talked about this in a jokey way, but with our person who is our loved one, we give permission for that person. So one of the things you want to do when you want to think about how you attend to them is a role reversal. If they were taking care of you, what would they do? In other words, if you were the one who had a memory loss and they were the one without a memory loss, wouldn't they take care of you in a certain way? And so wouldn't they also, you would say to them, take time for yourself. I got some memory loss, but that's okay. You go out and golf, you go out and do this, you go out and do that. If the answer is yes, then you have to do that. Because that is a better way for you to be able to take care of the problems that you will have during the day. We had problems. We had biological problems. She was incontinent. I had to change her and stuff like that. But seriously, the biological problems are not an issue. It really was the emotional problems that were the most difficult things. When she would cry and say, what's happening to me? That's the most difficult thing to take care of. And with someone with memory loss, if you can, sometimes you can then pull that person out and just change the topic of that work. But if not, what you have to do is look towards medical care, and that's antidepressants. Antidepressants are very, very useful for people with dementia. Not antipsychotics, they don't work. Not drugs like lorazepam or Xanax or alprazolam, they don't work either. They can cause you to fall. But also, antidepressants are very safe. for people who have memory loss, and they can be very useful. What you want to do also with memory loss is you want to go to your pharmacist, and you want to have your pharmacist, because they're really good and they like to do it, look over all of the medications and say, are any of these medicines making the memory loss worse? Because you want to ask that. Now, you can also ask your healthcare provider, your family doc, your nurse practitioner, or your PA. But frankly, pharmacists are really good. Let me give you a good example. Drugs for incontinence. Very common among men, common among women. Often that can make memory loss worse when you're actually taking the drug. It makes it worse. So sometimes you remove the drug and the memory actually can improve a little bit, and instead you're dealing with it on a topical way. You're just going in and putting on, you're putting on diapers, like Depends or something else, but they may actually be a little bit brighter because of that. So you want to go and look at all of the medicines that they're taking. You want to review them, at least if there's any new medication. You want to review them with the pharmacist. And you also want to review them with your doctor and say, do they really need to be on this? They're on too many meds. Well, maybe they are, maybe they're not. So it's something called deprescribing. So deprescribing, which we do not do as providers, let me tell you, as family docs, as PAs and nurse practitioners, we often put people, they'll end up in the hospital, St. Mary's Stoughton Hospital, somebody will put them on some medications because they'll say, we have to treat this. They're here for 2 days, and they go out of that medicine, and they don't need it anymore. And it's just after the hospital, nobody's looking at it because the practitioner you may be seeing thinks somebody else put them on it for a good reason, but then didn't look at the reason that they were put on it. So you want to deprescribe medications that they may have. You want to talk about that, in terms of that with the practitioner. I want to flow again into hospice for just a minute. People think when they go to hospice, oh, it's too soon for hospice. I'm giving up. Well, first of all, people, I still, by the way, I don't work full time. I fill in, so I work 3 to 4 days a month at most, 2 to 4 days a month, because I really like doing it. And I had a little old woman in with me the other day. First of all, let me tell you what old age is. Old age is 25 years older than you are today. So, you remember when you were 25, old age is 50, come on. My daughter Vanessa was a camp counselor at Camp Shalom, and the kids there wanted to know if she was double digits. Some of you are triple digits over here, but anyway, you remember when you're 50, old age was 75. When you're 75, old age is 100. So I was speaking at the Fitchburg Senior Center a while ago, and a little guy came up to me and said, Dr. Paster, how old do you think I am? I have learned never to answer that question. I said, 60. He said, I'm 102. I said, wow, you don't look a day over 80. And I said, pardon me, sir, what is old age to you? And he looked at me with a gleam in his eye and he said, 103. So there are some exceptions to age, to what that is. But so the first thing you have to realize in terms of hospice is, you see people that go to hospice, they're old. Get over it. A woman that I was seeing in Wanaka the other day, she was 85, and she said, why do my joint aches? I said, you're old. Now that I'm old, I can say that. I couldn't say it when I was 40 or 50. I said, you're old. I said, I'm old. I'm going to be 78, I'm old. My joints ache too. What else is new? But I was discussing it in a joyful manner. I wasn't just, I wasn't discounting what she said. She wondered why she had aches and pains. So with hospice, it's very important not to wait too long because they do a lot. For instance, they will come and bathe. Grace comes and bathes your loved one 2 to 3 days a week, sitting on a commode. They come, they have social workers that come once or twice a month or longer if they want to, or more often. They have an RN that comes and visits you. They tell you about other things in there. I looked at this great brochure, by the way. I was really impressed. This is the magic drawer, by the way. The secret of life is in this drawer. Let me tell you. I can't find it exactly, but longevity is in there somewhere. But anyway, this purple, can't wait to be fun. Magic puff. But this, if you look at this, look at all the resources you have in Stoughton. Let me tell you something. That is unique. It really is unique. This community, other than Oregon, which is more unique than this. Yeah, believe me, I know that. But I mean, this community is unique because this hospital and because of the social service agencies, because of the senior center where I've spoken before, it really is unique. So you have all of these resources around, use them. Use them. Go to the senior center, talk to the social worker, and say, this is what I'm happening with my loved one, what do you think I should do? And they'll give you some advice. So I went to the Vicksburg Senior Center, talking about Penny a little bit after she was on there, because hospice does not include physical therapy, but she was having some trouble. She had fallen down, broke her sacrum, fell down. And they said, well, there's a physical therapy that will come to the house that's reasonable. It was about the cost of a trainer, so we had a physical therapist that came to the house. I want to talk to you a little bit about the hospital. So when Penny fell down, I was in India. I have a project that I'm doing with Tibetan refugees on tuberculosis. I may have mentioned it, but I'm one of the physicians that cares for His Holiness the Dalai Lama. And I've known the Dalai Lama for many, many years. He stayed with us in 1981 in our house for 2 weeks because he came to Madison, came a number of times to visit and speak. But I was in India, and I was coming back, and my daughter Dee called up and said, Mom fell and she's in a lot of pain. And I said, take her to the ER. We're just outside Oregon. And I said, don't take her to St. Mary's, take her to Stoughton ER. They're really good, they're wonderful, they'll take care of her, and it'll be much quicker. I mean, there's no comparison. Because about 2 years before that, she had a gastrointestinal bleed from the medicine she was taking. And I had gone to St. Mary's, which is my hospital, and that's where I would hospitalize. And there were maybe 20 people in the emergency room. And then about maybe 5 minutes later, a sick child came in, and then somebody was having a psychotic break. And I thought, we're not going to be seen until 3 in the morning. Signed out, came here, and within an hour and a half, we'd seen a doc in the ER, had all the labs tests, we're up at the hospital, and she had blood going because she had a GI bleed. Maybe it was an hour and a half, 2 hours versus that. I mean, I just want to give a side, and I'm giving a public service announcement for the hospital. I'm not being paid to do this. You know, they can do the disclaimer. I mean, it's a real announcement. But let's get back to hospice. Don't wait too long. Wait shorter. Now, let's assume you're on hospice. Now, in hospice, once you're on there, that means you're not going to go in the hospital to do further tests. You can go in the hospital because you need care. If you get a pneumonia and you're in hospice, you can go to the hospital, get treated for your pneumonia. But if you have a GI bleed and you want to have it worked up to find out what it's about, you have to go off of hospice, which you can do that day. There's no waiting period. Unlike many things in the federal government, changing Medicare Part D where there's a waiting period or waiting for your tax return, there's no waiting period for going off hospice. So if you have a loved one, find out whether or not they qualify for hospice. You also don't need your doctor to go to get a referral for hospice. You can call them up. You can use this. There's probably 1-800 hospice. But use hospice, and I generally recommend people use a non-for-profit hospice. I love a Grace. They were the first hospice. Bill Rock is the one who set that up. But once again, hospice will give you some ideas with a loved one. They may qualify, they may not, but they may qualify 3 months later or 6 months later. And then you've got a group of people who are very useful that will help you to see what you want to do. Now, at this point, I want to hand out, I have a handout for you that I want to go over on some things you can do. I didn't want to give it to you at the beginning because it's the answer on the algebra test. Yeah. So, you can give it to you. Somebody want to get us and help and we can just pass? Otherwise, So I'm going to give you a checklist. It's always nice to go out with some piece of paper, even if you throw it on the garbage when you get So I looked up a few things that I thought would be restricted. Once again, I want to reiterate what this is going on. Taking care of yourself physically is your best defense against dementia. Making sure your blood cells taken care of, making sure your blood pressure is taken care of, making sure that you eat 5 servings of fruits and vegetables a day. The more colorful the vegetables are, the better off they are. I go back and forth on a multivitamin. I'm not against them, and now I think a multivitamin is useful, but if it's an excuse for not eating right, it's not useful. That's kind of what I think about that. I recommend vitamin D, 2,000 international units every day because we don't get enough sun. If you want to get enough vitamin D exposure in January in Stoughton, you have to go outside, open up your chest and your nose, yes ladies, you have to take off your reserve, and sit in the sun for 20 minutes. And if you do that, I am sure that the police will take you away, and then you go into extended care facility. And it's not good. It's not good. Calcium, some of your calcium should be from food. Some of your calcium should be from calcium tablets, roughly 1,000 milligrams a day, maybe 1,200 or 1,500. Once you drop below 1,000. I've got a good friend of mine, and she drinks skim milk. I hate skim milk. I don't like it. I like regular milk. And then she said to me, she said, I don't think of this as skim milk. I think of it as flavored water. No. And you know what? All of a sudden I thought, that's a great thing. It's milk flavored water. That's what skim milk is. But skim milk is an excellent source of calcium. That's what you should get for calcium. Regular exercise, that means doing something. It doesn't matter what you do. Get off your butt. Walk around. Sorry, no, I didn't say ass, I said butt. I like to say ass, I guess. You know, even though she died in 81, she's still in my brain. Yeah. Anyway, but doing something is extremely important. Staying away from the toxins in life, which is too much alcohol. 1 drink for women, 2 drinks for men. Probably alcohol is okay. There's some new issues on alcohol show that it may actually, there's an intermittent issue on whether or not it's detrimental or not. But I think a drink a day, a drink a day is fine. 7 drinks during the week, not to be taken on Sunday, all at the same time. And as I said, regular exercise. In the mental sphere, the important thing is to protect your brain. If you're going to be on a bike, I think being on a bike is great. Wear a helmet. I just came back from Seattle, and somebody who watches our dog, Lynn, a wonderful person, and I went into her house, and she had this big black eye. I said, what happened to you? Actually, I made a joke, which was wrong. I said, you know, you're not married now. Your husband died a few years ago. Who socked you? Nobody socked her. She got on a bike without a helmet and fell down. If she had fallen down with the helmet would have hit. She would have avoided having something for her, for her face. Making sure, once again, for your brain, you're protecting your brain. You wear your seatbelts all the time. Once again, that's the point. But also in your mind is learning something all the time. There's no way you can 100% prevent dementia, but there is, we know that lifelong learning is a major cue. That came from something called the Nun Study. The Nun Study, which came out of Kentucky, but it was a number of, Carmelita nuns who were in Milwaukee. Carmelita, I don't know what the name of them. What is it? Carmelite. Thank you. Carmelite nuns. And they, about in the 1980s, 70s, 80s, they said, we will give our bodies, our brain to science when we die, so you can do an autopsy on our brain. And it's a very interesting study because they followed these nuns over time. And the nuns did not smoke, they didn't drink to excess, and they often spent their lifetime together. They had different jobs, some cooked, some were cleaners, some did more jobs that were more intellectual, might have been keeping track of things. And they found a couple of interesting things in the study. They found that the nuns who were more intellectually involved, the ones who were the accountants and so on, had a lower rate of dementia than the nuns who were say, doing the janitorial work and cleaning. But that wasn't what was interesting. So when they autopsied the brain, they found a number of the nuns who did not show signs of Alzheimer's had plaques and tangles of Alzheimer's in their brain, but they didn't show signs of it. They were the ones with more intellectual activity. So why was it? Well, if you have ever used a computer, there are different ways to print. You can go to the icon, you can hit with Word Control P. There are 4 or 5 different ways to get to the same thing. When you learn how to learn when there's a roadblock and you don't know how to get around it, you have learned that I can get around this and you can do something about it. So it happened to me on the way to the hospital. I'm going down 51 coming here and it says detour like in 2 miles or something like that. And I thought, well, what if I'll make it to the hospital? But I know the back way to go, which I kind of like. over the bridge and through the woods, over there with the little mirror on there. It always makes me feel like I'm going to grandmother's house or something. So I went the back way. But I thought to myself, coming here, that's what we learn when we learn how to learn. So that's within what you have. So let's go over a few of these things. So, daily check-in on most days. 16 hours of sleep. Now, that doesn't mean you're sleeping solidly for 6 to 8 hours. Why do we say, I want to sleep like a baby? Babies don't actually sleep very well. They get up every 4 hours. I asked my trainer today, or I asked my trainer yesterday, I said, how much sleep are you getting? He said, don't ask. But I mean, it's fine. But being in bed for somewhere between 6 to 8 hours with the television and screen off is what your brain needs. There's something about the light that comes from, used to be cathode rays, the old TV sets, but there's something about light that comes from reading on a screen that's different than light that comes from this. So I recommend everyone, you're in bed for 6 to 8 hours, and are you going to sleep, on and off? Yeah, you're probably going to sleep, I don't know. First of all, Mother Nature calls. She certainly calls me in the middle of the night, sometimes more than once. I don't like her. I curse her. What am I going to do? But anyway, so you may not sleep continuously, but then think about what will make you sleep better. So there are noise generators that are wonderful. My kids use that all the time. They push a button and there's shh. When I was younger, I remember clock radios? Remember on the clock radio, you had this little thing you would turn so you could listen to music like WOS, which was rock music in Chicago. You're laughing. Did you listen to WOS? Yeah, it was wonderful. It was AM. Remember AM radio? Remember radio, actually? Anyway, you may need something to be able to go to sleep and listen to, but getting that sleep is critically important. Next, I took 10 minutes just for myself today without guilt. It's not easy. Not in the middle of chaos. You have to do it. If you don't do it, you can't recharge. You may take 10 minutes twice a day, but if you're not taking 10 minutes once a day, you're going to fail. Or, in fact, you may be failing right now to do your best. It's kind of like exercise. I mean, why would any of us exercise? I still think about it. I mean, am I really getting something out of this exercise? I mean, if I think about the number of minutes I'm exercising when I don't want to, am I getting that at the tail end of my life when I'm like 95 and I'm disabled and I can't do anything? And I go, I'm so good I've got these extra 3 years. No, we do exercise because we feel better now because we're able to get up and move around. So it's the same with taking 10 minutes for yourself, once or twice a day. I ate a nourishing meal or a snack today. Did you do that? I mean, it's okay to eat, we have to prepare food or we have to buy food. But are we going to have nourishing food and some? I move my body even just for a short walk or stretching. So it's not just going out and walking, it's moving your body, getting rid of those aches and pains. And then, of course, staying hydrated. Now, Americans are a little crazy with hydration. I want to show you something really interesting here. We have good water. Stoughton has good water, just like where I am. But I want you to, there's something very interesting. So it says, pure life, okay? Pure life. And it says, purified water. Well, first of all, water can't be purified. It is water. There's nothing purified about water. I mean, maybe strained. Enhanced with minerals for crisp taste. Have you ever read this label? I read it about a year ago. Minerals for enhanced taste? What's that? I gotta pull this up. Hold on 1 second. Maybe I can't pull it up. No, they put it on the other side. Oh, here it is. They put minerals in this. This is not pure. They put minerals in the taste so you will be addicted to it. I still remember, I love New Yorker cartoons. It was the devil sitting with a friend saying, I got a great idea. Why don't we bottle something that's really free for them and then charge them money? Right? That's what we have. But you gotta be hydrated. I'm sorry, I have to make that stop. I really against bottled water. Okay, weekly well-being boosters. I asked for help. Does everyone do that? No. You gotta ask for help. Because you're then respecting the person you're asking for help. First of all, they may have a good idea that you didn't think about. Like my son Eli. My son Eli is a smart kid. He went to MIT, so he must be smart. He's not smart at everything, There's always dumbness. People are smart in one way and dumb in another way. Yeah. We all know that. It's not just him. But when he told me to leave the room, I did my little circle around and realized I didn't have to leave the room to break the spell, which, by the way, try. By the way, you don't have to deal with somebody with dementia to try that. If you're in an argument, turn around with somebody, turn around in a circle while they're yelling at you. There's a book there. I now have a best-selling book called Turn Around in a Circle and Save Your Life. Stop all the arguments. I just thought about it, turning breakfast on the bed. Circle. And it's not what you like when you make it back to the circle. Just turn around again. Oh my God, isn't it even funny what's going on in your life? Jeez, I wonder what my wife would say. She would say, keep turning.
Now you know.
Next is, I said no to something I didn't need to do. So there's a woman named Judith Martins, I think. She wrote a book called The Guide to Excruciatingly Correct Behavior. Judith Martin. And years ago I read part of this book. It was an advice book like Ann Landers, you remember Ann Landers and Dear Abby books. And she was an advice columnist, and she had 6 words that we used for our whole lives. And I'm going to give you these words, memorize them or write them down. You're laughing. I'm so sorry, it's just impossible. When people ask you to do something, that's what you say. I'm so sorry, it's just impossible. I want you all to repeat it after me. Ready? 1, 2, 3. I'm so sorry, it's just impossible. Now, they don't know if you have cancer or the devil has come into your life, or there's a meteor. They don't know. And when they ask you why, you repeat it. And usually, you don't have to turn around in a circle, by the way. It
might help.
It might help. But when you repeat it, they don't know why, and basically, you don't want to do it. But if you say, I don't want to do it, they'll ask you why. So if you say, maybe it's very hard to argue. Yes and no are easy to argue. Maybe it's very difficult. I'm so sorry, it's just impossible. And you all said it, so you kind of committed to it. That's said no to something, didn't you? Connected with a friend or support group. Right? A lot of support groups all around. Maybe your church group, maybe something that's a senior center. But some support group, maybe your friends, some kind of buddies that you do. I was speaking to somebody yesterday, actually. I was meeting with somebody. They were involved in 10 Chimneys, which you may know is this tremendous thing between here and Milwaukee, and they're on the foundation board. And she said, she lost her husband about 20 years ago. And she said, I have a support group of other women who are like me who have lost their husbands. And we just meet each other for dinner. She said, it's really good, really helps me. And her husband died 20 years ago. You never get over some of the grieving, which is okay. The deeper the love, the deeper the grief. It's all right, getting over that. I want to mention something else. I want to mention something else. It's very interesting. I have asked people, I didn't realize how common it was, who have lost a loved one, do they talk to them? And I have discovered that it's pretty much universal. That you talk to them and you know what they would say. And it's a very interesting, I found it very interesting because, it's very interesting, but it's part of the grieving, yes?
My mom is 101 and she still talks to my dad every night.
Every night. And she still talks, because she knows it. And it's comforting, there's nothing wrong. I had people in my office for years who would come in and they would say, I hear my husband or I hear my wife talking, is there something wrong with me? Because they would question it. They wondered whether or not there was something wrong, which there was not. So, spend time with Mother Nature or outside. That's really important. Look outside. It is wonderful. It's beautiful. The greens were so gorgeous coming up here. And the flowers are coming up and everything. You look in today and say, it's awful, it's rainy, it's cloudy, or you can look outside and say, look at all the greenery. But Mother Nature is very important. I scheduled something or enjoyed something I love, music or a book or a hobby. This is weekly. I laughed, I smiled, or I let myself feel joy. So you don't want guilt to be the hat that interferes with the ability to feel joy. You don't want to feel guilty that you're having a good time because your loved one isn't there having a good time. And your loved one, if you've been with your loved one, would say, please enjoy yourself. Don't think of me all the time. So you have to think about that. You want to put yourself once again into their perspective. I took a break from caregiving, screens, or stress. Well, you can't get rid of stress, but you can take a break if you can. If you can have somebody who wants to share with them. Let's do emotional and mental health check. I reminded myself they have dementia, it's an illness, and it's not that. They have dementia, it's an illness, and it's not that. And that's important. So I'll give you a story. I'm filled with stories. So a week before Penny died, a week before Penny died, my son Zach came over the house and he said, "She's not making any sense." You know, I'm there, and I had noticed, but he had not seen her for 2 days, and she was much worse. So we called our kids, and they also had 2 from Seattle, 1 from Boston. It was really interesting. My daughter Dee Dee, she's a doc, family doc. She also works in, she's certified in addiction medicine, so she works substance use disorders. She works with women in Seattle who are pregnant and who are living on the street. And then her husband, Nicholas, works in Bethel, Alaska. He goes up there for 2 to 3 weeks at a time, and he's back home with their kids for like 6 weeks. So he was going up to Alaska. She was scheduled to do this. Mom is sick here. I'm talking to her, and she said, "Well, do you think I should come tomorrow?" And I said, "We don't know." So she got on the airplane, my daughter Vanessa got on the airplane. Son Eli came from Boston. And we were all able to be with one another. It was really lucky in many ways. Beautiful day like this, a little sunny, it was in September. There were flowers, and then she said spontaneously, "I'm so happy." She had not said anything like that for months, and reminded me that she had been in there. Once again, somebody's reminded me, she had been in there all along, but now she's surrounded by her kids. And it was the first time in 20 years that all 4 of our kids were there without their spouses, without their children, and without anyone else. So it really was a very special time. But not everyone necessarily gets that. So a very good friends, and he was 85 years old, passed away about 3 or 4 months ago. And they were very smart, really smart people. He was a professor at the university, all the people are smart, but not smart with everything. So he was undoubtedly suffering, and their friend, their good friend, they didn't even call me up. They weren't even that smart to say, "Hey, I think he's really in a lot of pain." And they didn't have the relationship with whatever hospice they had, it wasn't a Grace. They didn't know that he was still suffering from pain, and you can give him more morphine. It's not, they would say give him 1 pill every hour or 2. They didn't realize you can actually give a pill every half hour if they need it. You just can't get the whole bottle. You don't have, death with dignity, that's all. Whatever it was, they misinterpreted. Remember, these are really smart people who misinterpreted things, but then never bothered to call. And so then he said things that you might say he shouldn't have said, whatever it was. He said things that were very disturbing to the family. And they hadn't gotten far enough in understanding what happened. He had a brain tumor. That what he said is not actually what he meant. And they took it seriously. And this was like 3 or 4 months ago. And they're still suffering for it because they took it at face value. And it really was. He was a really nice guy, a great relationship with his family. But they didn't plan beforehand. And they didn't have the wherewithal to say, "We don't know what we're doing. I think I'll call for help," because they're smart, right? And they took it, "Well, this must be it." So that's the call. That's once again reiterating that call. So reminding myself they have dementia, it's their illness. Acknowledge my feelings without judgment. Feelings. Breathe deeply and mindfully. Mindfulness is great. There are a number of apps on this phone. Healthy Minds is a great app, by the way. It's free. Richie Davidson at the University of Wisconsin is part of that app. It's an app that helps with mindfulness. They have wonderful 5-minute meditations, 10-minute meditations that can be incredibly useful, guided meditations. I think that's really useful, just to settle yourself. And I reach out for professional support if I feel overwhelmed. That's what my friends did not do. They didn't reach out. Why didn't they reach out? I don't know. I mean, it's not something I would ever ask, and I would never discuss it with them. And then your affirmations. Every day. I am doing the best I can with what I have. My well-being matters too. And I can't do it all. That's okay. So those are the things really to think about. Now, one of the ways to perspect this, I wrote a book on longevity 20 years ago, and I'm writing a new book on it that I just started, that I find really useful. I actually want to look at their phone and pull something up, but I'm going to do that. Because I'm going to do it, because I pulled this up, it actually was on the screen. So, well, because I want to adjust to it, I can't, it's like, how do I find this? But your goal in life, one of the goals in life that we have, if I can just get with it, I'm sure it's not before, is to figure out how to be optimistic, vibrant, and happy while reducing suffering in your loved one, so that you can develop resilience to be able to bounce back during the days that are more difficult. So to be optimistic and happy and joyful, you have to be able to do things that make you optimistic, happy, and joyful, and find those times to do it, because you cannot be with them 100% of the time. So years ago in medical school, when I went to medical school, University of Illinois, medical school, it was tough. Medical school was not easy. It was November rather, and I was really unhappy in certain ways. So I was with friends. I didn't have enough money to pay for my room and board. I was living in an apartment with some other people. I was having trouble getting enough money for the tuition. And I didn't have a girlfriend. That's right. So I went to the Zen Center in San Francisco during 8th grade. I went on the Greyhound bus. Any of you take the Greyhound bus cross country? Cross country? The Greyhound bus cross country. You're willing to admit it. $25 round trip anywhere. $50 unlimited travel. I did 10,000 miles when I was on the bus. Let me tell you something. That was something. Because that's when you could smoke and drink on the bus. And chew tobacco too. Anyway, I was disgusting. And at 2:30 in the morning, they get everyone off the bus and clean the bus for you. And they open up the Post House Cafe, that's the name of their cafe, where they have pre-chewed food. It's disgusting. Anyway, so I ended up in San Francisco at the Zen Center, and I spent basically a week on mindfulness. Very, very useful. And on that, there's a Zen koan that I want to tell you about that I found very important. 5:30 in the morning, they wake you up with a drum, and you would go and sit. I'm a nighttime person. 5:30 in the morning is about the time I would go to sleep, not the time I would wake up. But the Zen koan was attention. Great is the problem of life and death. Time passes quickly by, and opportunity is lost. Each of us should strive to awaken. Awaken. Take heed. Do not squander your life. Do not squander your life. And so, when you leave today, you got a little checklist. You pick out one thing you're going to do. You're going to do differently. You're going to do it to help yourself. You're going to do it to help someone else. Because you're not squandering your life when you're helping other people. You're doing the right. Thank you very much.